More than 1 million people and 200 countries are grappling with coronavirus. So what is the situation in India? To help us understand, we have with us Dr. Roderico Ofrin, and he is the Regional Emergencies Director working with World Health Organization. Thanks for talking to us and welcome.
Good afternoon.
So, if you could describe India's response so far in this battle against coronavirus.
Response of India is a very comprehensive one. Of course, it begins with very good surveillance and contact tracing, which means you are able to detect the case, isolate the case, and care for the case. It has an area where it strengthened all its laboratories to be able to test the cases, prepare its hospitals and healthcare workers for infection prevention and control, and a huge capacity building effort around this, as well as risk communication. You might have seen how much is out there from the Ministry of Health to combat misinformation, myths, and rumors, and that at the same time empower people to act properly with this disease.
In terms of your association, WHO's association with the Government of India, are you associated with anything, any shape or form?
Yes. Well, as an organization, WHO is a specialized technical organization of the United Nations for health. It is unique in a way that it is built together. It's a member state organization, and therefore our work cannot be independent of the Ministry of Health. It is always with the Ministry of Health and in support of the Ministry of Health. So much of our work for preparedness and response for COVID has been to support the work of the Ministry of Health, whether technical or operational.
Could you give us a sense of where do we stand now? What is the situation in India for all the people watching?
For India, as you may know, there are many union territories as well as states. So we cannot just summarize it into one one sentence. WHO has classified the transmission scenarios into 4, where there is no case or an imported case, where there are sporadic cases, where there are a cluster of cases or multiple cluster of cases, and community transmission. At some point, every state will be in different transmission scenarios. However, the core of the response remains the same. It is about getting containment where containment is due. Meaning you have to have very good surveillance. You have to detect the case, test for it, isolate who is positive or suspected, and care for them.
Because you mentioned that it is a new disease, and the underlying assumption is there that we don't know much about it. Even in terms of dealing with such a problem, say for example doctors. So is there any kind of special training that has been provided by you people, or is there any training that has been given to those people to tackle it?
Yes, it is an amazing effort that the Ministry of Health together with WHO has done, doing a lot of training with healthcare workers, even using information technologies, where you can be connected even without traveling. In this day of social distancing, even our responses are through webinars. So what I know very well is that the Ministry of Health with WHO has done trainings on surveillance, contact tracing, what are the case definitions, how to do that, how to report that, infection prevention and control, how to use your PPEs, some very specialized training on clinical management. What is interesting though with this disease is that although it is new, a lot of the research has come out, and many of the respected journals have also provided their new papers, peer-reviewed papers for free, for the whole body of knowledge to be accessible, so that every country, every health professional has access to that knowledge.
Lessons that we have learned so far in terms of capacity building, do you think that we have learned anything and it will lead us to somewhere in future? How do you explain that?
We are learning as we respond. At the same time, we are going to learn a lot comprehensively when this epidemic ends. As you have seen reports of the transmission dynamics, why is it that we know now that maybe 80% of cases are actually mild or even asymptomatic, and 20% are severe or critical? We also learned that it's very early on that the virus is transmitted through droplet. and that if we take care of our cough and sneeze, if we wash our hands, you're able to stop it. So, in fact, this virus was sequenced within 20 days of its identification and announcement. So there are many things to learn. And now there are clinical trials, we call the solidarity trials, that countries are participating in, so that future diagnostics and therapeutics and vaccines have a more robust evidence for them to be able to be deployed and used.
How long do you think it's going to continue? Do we have a certainty regarding it, any particular date that you can give us? How long do you think we all will be engulfed into this problem?
There is no certainty as to which date this will all end. What is only sure is that we will live with COVID-19 as a disease. And what I can say is that there are actions that we as individuals can take, such as washing our hands, covering our cough and our sneeze with our elbows so that we don't use our hands and to spread the disease, cleaning surfaces, social distancing or physical distancing, that would help slow down or break transmission. There are actions that we need to do as individuals. These lockdowns that we have are opportunities for us to be able to slow down transmission. And maybe with that, if we are cooperative as a community, as a public, we're able to better take care of ourselves, take care of others, and of course, take care of those who take care of us, our healthcare workers.
That's a great message to end this conversation. So, Dr.
Thank you
so much for talking to us.
Thank you.
An expert from WHO is clearly saying that while it may be the role of the government or institutions to take your care, it's also down to you. How do you behave, how do you conduct, and make sure you practice social distancing and cleanliness. Thanks for watching.